Hi, it's Congresswoman Jan Schakowsky. I'm back with Plans and Pans. If you missed me last week, it's because I went to Washington, where it wasn't easy to do anything. There was really difficult time because we had to all be separated. Anyway, I went there to vote on two different bills. One to set up an oversight select committee so that we didn't have price gouging and fraud and all kinds of ways that big companies were getting money that they shouldn't be getting. And then also to vote on another relief bill, $44 billion. And some of that was to try and improve and add more people to the Paycheck Protection Program, the PPP. Well, one of the reasons it was hard for so many small businesses, and in mind we had the mom and pop stores, the small businesses that really make our communities and neighborhoods run. But in fact, there was a headline in the New York Times that said that banks gave richest clients concierge treatment for pandemic aid. That was the small business program. And it was hedge fund managers and actually big corporations that had franchises that got the money. That's not what we meant. And so in a few days that money ran out. We wanted to put more money into the program, and we did. Another 300 billion or so in it. But we also did a carve out for small banks, community banks, small banks and credit unions, and for the more unbanked or underbanked people to be able to get it. Now, one of those banks was the Devon Bank. That's my bank. It was my mother and father's bank as well. It's been in the Rogers Park neighborhood for decades now. I just had a press conference that included the president of that bank that talked about the frustration of his small bank being able to even access the money at all in the first round of the Paycheck Protection Program. And so now he's been able to get a few people in because the whole system for several hours today actually broke down. And he pointed out every loan that he gets, he made a count of just the loans that they tried to get today would have meant 1,500 workers that were able to keep their jobs. That's why this program is so important. It gives employers money and then forgives the loan if they keep the employees on the payroll. So it's about jobs, jobs, and jobs. But also in my press conference today, I had a woman who is self-employed. She's been self-employed for a long time. And she's been paying her taxes and wanted to apply for this loan program also. She has an accountant who helped her figure out how to apply for the money. Well, she still hasn't gotten it. And many of her friends that she talked about haven't gotten it. I also talked to someone who is at the College of DuPage. He teaches a class there. But he gets most of his income from driving Uber and Lyft. And supposedly he's to be eligible for the unemployment insurance program. But the Department of Labor has been so confusing with its guidances that it's been really hard for states like Illinois to set up the program to cover people who we meant were able to get the loan and the unemployment insurance. Excuse me, setting up a whole new program, but you need help from the federal government to know exactly who's eligible and ways to do it. So that hasn't happened. I also talked to another independent contractor. He's a manufacturer's representative. He's been doing it for 30 years. And he's having a heck of a time getting access to any kind of the programs. He thought he would be able to, and then he was informed that he actually wasn't eligible, and then he tried another one, and it didn't. It hasn't worked. And finally, talked to a small real estate. He has some real estate. He has some buildings. This is he knows all his renters. They're all having a really hard time paying their rent. But the other problem is that he has not accessed yet his stimulus money, the $1,200 for an adult, the $500 for children, and so those of you who are having trouble doing that, please contact my office. We'll see what's happened to the money. But it's been hard for all of these programs, and that add up to over $3 trillion. Now, of course, some of that money, a lot of that money, has gone to hospitals, and it's gone to our frontline essential workers. And we have certainly we want to make sure that all of the heroes who are out there working every day are getting the personal protective equipment that they need, that the hospitals are getting what they need. But I also just heard from a not-for-profit that has more than 500 individuals as employees, and they do mental health services for the most needy of people. And so they don't fall into any category right now. So I spoke on the caucus conference call and said, we have to do something about it. Adam Schiff emailed me right back and said, I'd like to work with you because I've got such a not-for-profit that works with the LGBT community that also needs money, and they have more than 500 employees. So people are suffering out there. My staff is hearing sad stories, difficult stories, adult people crying every day because they are worried that their businesses go under. They are worried about their employees who are worried about the businesses going under. This is a very, very frustrating time. I know it, for people who are staying home too. And you know, I'm in this pretty big house and not in a one-bedroom apartment with a bunch of people, making it very tense. A lot of pressure, lots of increase in domestic violence, in violence against children. So, you know, we're working hard to get through this. We have to do what we're doing, the social distancing. We have to stay at home, those of us who can. If we're gonna get through this, we have to have more testing. We have to protect people that are in nursing homes, a top priority for me right now, because almost half the deaths in this country have taken place now in nursing homes. We have to have more infection control in the nursing homes. I'm working on legislation for the next bill, and I hope it's soon, that are going to resolve many of these problems. We can get through this if we work together, if we have cooperation at the federal and state and local level. I believe that we will. So take care, be safe, be well, and thank you.